If your last cholesterol panel came back borderline and your doctor said, let's watch it, you left that appointment with the right answer to the wrong question. A study published in January 2026 found a number in that same panel that predicts vascular circulation problems better than LDL does. It's a number sitting in data you already have. Most doctors never calculate it. In March 2026, the American College of Cardiology released the first major update to cholesterol guidelines in 8 years. This video is built on that guideline and 5 peer-reviewed studies. By the end, you'll know the exact mechanism connecting cholesterol to vascular circulation in men over 60. The specific number in your blood test that predicts arterial blockage better than LDL, and 6 questions to bring to your next appointment. Here is the part most men have never been told. More than half of men aged 60 to 75 experience some degree of vascular circulation change. Most never mention it to anyone. Most assume it is age. It is not age. It is a measurable biochemical process, and what's measurable can be changed. Your body has 2 arteries most relevant to this conversation. The main artery supplying your heart is roughly 4 millimeters wide. The artery responsible for circulation to the pelvic region is roughly 2 millimeters wide. Cholesterol plaque does not hit them simultaneously. It hits the smaller vessel first. That means circulation changes in the bedroom can appear 3 to 5 years before a heart attack. The Princeton the Fourth Consensus Conference was published in the Journal of Sexual Medicine in 2024. It made this official. Men with vascular circulation issues should be evaluated with the same cardiovascular risk tools used for heart disease. Same process. First seen through the smaller vessel. Here's the mechanism inside that smaller vessel. Picture a traffic light built into your blood vessel wall. Green means the vessel relaxes and blood flows through. Red means nothing gets through, no matter what signal your body sends. The molecule that controls that light is called nitric oxide. Researchers at Johns Hopkins University, funded by the National Institutes of Health, identified how high cholesterol jams that signal. Elevated LDL triggers oxidative stress inside the vessel wall. That stress damages the protein responsible for producing nitric oxide, called ENOEs. Instead of releasing nitric oxide, it begins releasing hydrogen peroxide. The green light doesn't dim. It doesn't flicker. It turns permanently red. That is the arterial pathway. But the effect doesn't stop there. A 2022 study followed 106 men between 60 and 75 years old, specifically this age band, and found that unhealthy cholesterol metabolism also suppresses testosterone production. Lower testosterone reduces blood flow signaling at the neurological level. 3 dominoes. Cholesterol, testosterone, blood flow signaling. 1 root cause. This is why treating circulation issues without addressing cholesterol produces incomplete results. The problem is upstream. And then there is the third pathway, the one that changes what you should ask at every future cholesterol appointment. Every cholesterol panel you have ever received lists 3 numbers: total cholesterol, LDL, and HDL. Your doctor watches LDL. A study published in January 2026 in Frontiers in Endocrinology followed 326 men. 216 had confirmed arterial circulation issues, 110 were healthy controls. The researchers asked one question: which cholesterol number actually predicts arterial blockage best? Not LDL, not total cholesterol. Residual cholesterol. The formula is arithmetic. Total cholesterol minus HDL minus LDL. The remainder, everything left after the 2 named fractions are subtracted, was a significantly more accurate predictor of arterial blockage than LDL alone. A value above 0.595 millimoles per liter, roughly 23 milligrams per deciliter in US units, was dramatically predictive. Every number required to calculate this is already in your last blood test. It has been sitting in the data untouched. 1 nuance before the action steps. For under 5% of men, cholesterol-lowering medications can have downstream effects on testosterone levels. This is one reason the 6 questions ahead matter. You just heard about a number sitting in every cholesterol panel you have ever received. Uncalculated, unremarked on, absent from every 7-minute appointment. That gap is exactly what this channel exists to close. New videos every Tuesday and Saturday. Subscribe and hit the bell. Now, what you can do with this. Step 1. Calculate your residual cholesterol from your last blood test. Formula total cholesterol minus HDL minus LDL. Target below 0.595 millimoles per liter or below 23 milligrams per deciliter in US units. The numbers are on your last lab report. Pull it out tonight. Write the result down. This number tells you something different from LDL. It specifically predicts arterial blockage in the smaller vessels that fail first. Step 2. This is reversible, not theoretically, clinically. A 2010 study in the International Journal of Impotence Research found that men who had shown no response to standard circulation medication began responding after cholesterol treatment with atorvastatin. LDL reduction restored enough endothelial function for the vascular pathway to work again in men who had been written off as non-responders. The biology runs in both directions. Step 3. Support the system through food. The 2026 guidelines explicitly endorse the Mediterranean dietary pattern alongside medication for vascular health in men over 60. Olive oil, fatty fish twice a week, nuts, legumes, leafy greens, limited processed carbohydrates. These components act through the same nitric oxide pathway that high cholesterol disrupts from the opposite direction. Starting tonight, pull your last blood test, calculate residual cholesterol, write it down. That single action puts you ahead of most men, walking into their next cardiology appointment. Step 4, 6 questions to bring to your next appointment. Write them down, bring them on paper. Question 1. Can you calculate my ASCVD 10-year risk using the new 2026 Prevent equations? Question 2. What is my LDL specifically? Is it below 100 milligrams per deciliter? Question 3. Has my LPA ever been tested? The 2026 guidelines recommend it. Question 4. Could my cholesterol levels be contributing to my circulation changes? Question 5. Is my residual cholesterol, total minus HDL minus LDL, within a healthy range? Question 6. Are there lifestyle changes that could improve both my cholesterol numbers and my vascular health? These 6 questions change the quality of that conversation. You are not asking to be difficult. You are asking to be informed. 2 common mistakes to avoid. First, stopping a statin because of something read online. If LDL is responding and your doctor recommended it, stopping without medical consultation can undo months of recovery. Concerns about side effects belong in question 6, not in a unilateral decision. Second, we are waiting for symptoms before having this conversation. Vascular circulation issues are themselves a cardiovascular risk-enhancing factor. The conversation is overdue the moment circulation changes appear, and not after a heart event makes it urgent. Timeline, weeks 1 to 2. Information phase, residual cholesterol calculated, 6 questions written. 1 evening of work, weeks 3 to 5. If Mediterranean dietary changes begin consistently, early endothelial improvements are measurable within 3 to 4 weeks. Energy and sleep are often the first signals. Weeks 6 to 8, if LDL has begun to trend down, this is the window for early vascular improvements to emerge. The small artery sends the first warning. Most men never find out. Most men over 60 in this situation have been carrying 2 concerns they assumed were unrelated. A cholesterol number the doctor called fine, and a circulation change they called age. They are the same concern. You now know the number that connects them. You are not behind. You are just now asking the complete question. If this video closed a gap your last 7-minute appointment left open, the hype button below tells the algorithm to show this to other men like you. 3 uses per week. Use it. We'll see you Tuesday. Before we go, if you are currently taking cholesterol-lowering medication, do not stop or change your dose without speaking to your doctor. This video is educational, not medical advice. Always consult your physician before changing diet, exercise, or medication.